Assalamu alaikum everybody. Bismillah ar-Rahman ar-Rahim. In our last presentation, we started talking about the pharmacokinetic process. We said it is involved in 4 stages. The first 2 stages, absorption and distribution, the function of which is to deliver the drug to the site of action. Once the drug produces its action, it will be eliminated out of the body by the process of metabolism and excretion. The process of elimination depends on the nature of the drug nature. If the drug in the body is present as lipid soluble or lipophilic, lipid soluble, in this case it will be exposed to metabolism first, followed by excretion. This is if the drug is lipophilic in nature or lipid soluble. If the drug is water soluble in nature, i.e. it is ionized, in this case it will be eliminated through the process of excretion only. Okay? Then drug, if they are lipid soluble, they will be metabolized first, then excreted. If they are water soluble, they will be excreted immediately. So today we will concentrate on the process of metabolism. We will speak first about the different phases of metabolism. This includes phase 1 and phase 2. How phase 1 is done through oxidation, reduction, or hydrolysis, and how this phase 1, will produce what's known as enzyme induction, and how this enzyme induction can lead to tolerance and can lead to drug-drug interaction. Then we'll talk about phase 2 metabolism. First, we said metabolism main function first is to convert the drug from lipid soluble, i.e. lipophilic, to water soluble molecule. Why? Because we know that the lipid soluble fraction can cross biological membrane, therefore it will be reabsorbed and can be returned back to the general circulation. This is the first function of metabolism, is to convert the drug from lipid soluble to water soluble that can be excreted through different excretory routes, as we will see later. The second function of metabolism, sometimes, and most of the times, it converts pharmacologically active molecule a molecule which has pharmacological activity, to inactive molecule or inactive metabolite. This is in general. In general, metabolism will convert pharmacologically active drug to inactive metabolite, i.e. it has no pharmacological action. It produces no action. But in rare cases, or in some cases, sometimes, the process of metabolism will convert inactive drug which has no action, inactive drug, to active, pharmacologically active drug. In this case, the inactive form of the drug is known as prodrug. Okay? The active form can produce action, then it will be further metabolized to inactive form. So the second function of metabolism, pharmacologically, it will convert active drug into inactive metabolite. If it produces the opposite, if it converts inactive drug to active metabolite, in this case, the drug is known as prodrug. We have many very famous examples about prodrugs. Most famous is the codeine, which is an analgesic, well known, and also it is used as the antitussive drug. Second most famous example is enalapril. Enalapril is ACE inhibitor, which is used in treatment of hypertension and cardiac failure and different other uses, but mainly used as antihypertensive. Another example is L-DOPA, which is used in treatment of Parkinsonism. These are examples of prodrugs. They are converted by metabolism to active metabolite. Okay? Metabolism can take place in many places. Third thing, in the metabolism, can take place in many places. For example, gastrointestinal tract. Gastrointestinal tract, they have metabolizing enzyme. Some drugs, they are exposed to metabolism in the GIT before they can reach the general circulation. Kidney, for example, can be a site of drug metabolism. But the most important site of drug metabolism is the liver. Liver is the most important or main site of drug metabolism. Therefore, we expect that if there is a problem with the liver, like a liver disease, we expect that drug metabolism will be affected, will decrease the drug metabolism. Therefore, drugs which are metabolized in the liver, if there is a liver disease, this will affect drug metabolism. So, how metabolism takes place? How metabolism takes place? Metabolism of drugs in the liver mostly takes place through two different phases, two main phases. Phase 1, metabolism, and phase 2, metabolism. Okay? Metabolism in the liver takes place through two phases. Phase 1, metabolism, and phase 2, metabolism. The main function of phase 1 metabolism is to convert lipid-soluble molecule drug to water-soluble drug or metabolite. Okay? Then the main function of phase 1 is to convert lipid-soluble drug into water-soluble drug. This water-soluble metabolite, it is either excreted or it can enter phase 2 process of conjugation. Okay? So most drugs that are exposed to phase 1, if they are lipid soluble, where they are converted to more water soluble metabolite, this water soluble metabolite will be either excreted through different excretory routes, or it will be conjugated with different conjugation, as we will see later. Okay? So, how drugs that are converted to water soluble metabolite? How drugs are converted to water soluble metabolite? I mean, the stages of phase 1. There are 3 different mechanisms. Phase 1 is composed from 3 different mechanisms. Phase 1. There are 3 different mechanisms which converts the drugs to water-soluble metabolite. The first, by a process known as oxidation. The second, by a process known as reduction of the drug molecule. The third is done by what's known as hydrolysis. Okay? All these 3 happens in phase 1. Hydrolysis usually takes place in plasma by esterases. Usually, the result of hydrolysis is a short duration of action. Usually, drugs which are metabolized by hydrolysis, they have very short duration of action because of the quick hydrolysis, as we will say later. Short duration. They are quickly metabolized. Therefore, they will have very short duration of action. أشهر مثال, the most famous acetylcholine, which we'll talk about when we talk about cholinergic drugs, and as well lidocaine, the most famous local anesthetic. Okay? The phase 1 can be oxidation, reduction, and hydrolysis. Hydrolysis can take place in many places, but most important is the hydrolysis which takes place in plasma, like for esterases, drugs of ester nature, where they are metabolized very fast by plasma esterases, producing very short duration of action, and the most famous is acetylcholine and lidocaine. Oxidation and reduction takes place mostly in the liver by what's known as liver microsomal enzymes. Okay? Therefore, oxidation and reduction takes place in the liver by liver microsomal enzymes, especially the cytochrome B450, which are known as CYB450. There are different enzymes, isoenzymes of different structure. There are many, maybe in hundreds. These liver microsomal enzymes, they are responsible for the process of oxidation and reduction and takes place in the liver. Therefore, we expect that in the process of liver disease, When there is a liver disease, that means liver microsomal enzymes are affected. Will affect the liver microsomal enzyme activity. So what will happen to the metabolism? Will be slow metabolism. Metabolism by oxidation or reduction in the liver by the liver microsomal enzymes will be slow. Therefore, in this case, metabolism of the drugs will be reduced, i.e., accumulation of the drug will take place in the body. Accumulation of the drug in the body will take place. If accumulation takes place, this will lead to toxicity. This is dangerous. This is dangerous. Therefore, if any drug which is metabolized in the liver by liver microsomal enzyme, we expect in the liver disease, their metabolism will be slow, and if their metabolism will be slow, they will be accumulated to the body, in the body to the point that they can produce toxicity. So in this case, what we have to do? We have to reduce the dose. We have to reduce the dose. If, for example, a drug is metabolized by liver microsomal enzyme and we want to give it to somebody who's suffering from liver cirrhosis, for example, in this case we have to reduce the dose to make sure that the drug does not produce toxic effect. Okay? Second thing we should remember about the liver microsomal enzymes is the chronic administration. Drug chronic administration. Suppose I take the drug for a long period of time, repeatedly for a long period of time. What will happen? Suppose I take the drug which is metabolized by liver microsomal enzyme. I take the drug for a long period of time. What will happen? After certain period of time, the drug itself will increase the activity and concentration of liver microsomal enzyme. This process is known as enzyme induction. Very known process. Like, for example, if I take phenobarbital, a drug, phenobarbital, any barbiturate actually would do that. Phenobarbital, if I take it for a long period of time, what will happen? This phenobarbital, the drug, will increase the activity and concentration of the liver microsomal enzymes. This is known as enzyme induction. So what will happen? What do you think will happen? What will happen to the metabolism of the drug? The drug is metabolized by liver microsomal enzyme. Now, the liver microsomal enzyme, they are more active and present in higher concentration. So what will happen to the metabolism of the drug? Will increase in metabolism of the drug. Will increase the rate of metabolism of the drug. The drug will be metabolized faster. If the drug is metabolized faster, that means faster elimination. It will be eliminated faster out of the body. If it is faster elimination, معناها decrease in action. Action is decreased. So we started with the drug producing an action, then by taking the drug continuously, the drug itself increase the activity and the concentration of liver microsomal enzyme. This will increase metabolism of the drug, i.e. the drug will be eliminated at a faster rate. That means decreasing the action of the drug. This takes place after some time, maybe weeks after drug administration. This is known as tolerance. This is known as tolerance. Okay? This tolerance means that the drug the dose that can produce an action, after repeated administration, the effect will start to disappear. بالعربي نسموه تحمل. Okay? Tolerance. This tolerance took place at the site of metabolism. That's why it's known as pharmacokinetic tolerance. Pharmacokinetic tolerance. Because we'll speak about other type of tolerance, which is pharmacodynamic tolerance. We'll speak about it in the next sections. So this is pharmacokinetic tolerance. So what's pharmacokinetic tolerance? Pharmacokinetic tolerance takes place when a drug will increase the activity and the concentration of its metabolizing enzyme. Therefore, drug metabolism will be faster elimination, and decrease in action. Okay, this is pharmacokinetic tolerance. This pharmacokinetic tolerance happens after chronic administration, not acute. Chronic administration. The other name of it is chronic tolerance. Chronic tolerance, and some people they call it chronic pharmacokinetic tolerance. Okay? So this is the consequence of taking the drug chronically. If I take the drug chronically, chronic administration, the drug itself will increase the activity and the concentration of liver microsomal enzyme. This is, we call it enzyme induction. Enzyme induction. This enzyme induction will result in faster elimination of the drug, i.e. decreasing the action of the drug. We call it tolerance. Tolerance took place at the metabolic site. That's why it's known as pharmacokinetic tolerance or chronic tolerance. Okay? Okay. The third thing I should remember about liver microsomal enzymes is the drug-drug interaction. It is a site of drug-drug interaction. Drug-drug interaction means that I am taking two drugs at the same time and an interaction will take place between them. Suppose that I'm taking phenobarbital, for example, a drug A, which is enzyme inducer. Like, for example, carbamazepine. It is well known, carbamazepine. This is a drug which is used as anti-epileptic drug, carbamazepine. I'm taking this drug for treatment of epilepsy. I'm taking the drug for a long period of time. This is strong enzyme inducer, so it will increase the activity and concentration of liver microsomal enzyme. This doesn't take place in few days, but it takes place after a few weeks, maybe more than a month or so. Okay? Suppose during that time, while I was taking drug A, I start taking drug B. Suppose drug B is metabolized by the same enzyme. Drug B is metabolized by the same enzyme. So what will happen? Metabolized by the same enzyme of drug A. What will happen? Drug B will find higher concentration of the enzyme and higher activity. So what will happen to drug B? Will be faster, يحصل له faster elimination. Will be faster elimination because it will be metabolized faster. That means that we will have weak action or no action. Because drug B is eliminated faster from the body because of the higher activity and concentration of the metabolizing enzyme. This will result in loss of effect of drug B. This is known as drug-drug interaction at the metabolic site. This is known as drug-drug interaction at the metabolic site. So in general, we can say that any drug, when taken chronically and it is metabolized by the liver microsomal enzyme, it will induce its own metabolism, it will increase its own metabolism, and as well the metabolism of other drugs which are metabolized by the same enzyme. Okay? So we said that liver microsomal enzymes, there are three things to remember: that it will be affected by liver disease. Liver microsomal enzymes can be affected by the chronic administration where tolerance can take place, and the liver microsomal enzymes can be a site of drug-drug interaction where the effect of a drug disappears if it is metabolized by the same enzyme system. Last thing about the liver microsomal enzyme, that there are drugs that inhibit liver microsomal enzyme, inhibit cytochrome B450. There are many drugs which have the ability to inhibit a liver microsomal enzyme or cytochrome B450. There are many examples. For example, the antibiotic ciprofloxacin. This is very famous antibiotic. Also cimetidine, which is H2 blocker, is a famous H2 blocker, and it inhibits liver microsomal enzyme. Also there is protease inhibitors like ritonavir. Ritonavir is antiviral protease inhibitor. It inhibits cytochrome B450. There is azole derivatives like itraconazole. Itraconazole, it is antifungal, belongs to the azole antifungal drugs. These drugs, example of drugs which can inhibit cytochrome B450. Therefore, what will happen? They will inhibit in metabolism. The net result, they will inhibit the metabolism of other drugs. Metabolized by the same enzyme. So what will be the result? Do you think the other drugs will have higher effect or a lower effect? They will have a higher effect. Why higher effect? Because they will be metabolized at a slower rate, slower metabolism. That means these drugs will accumulate in the body producing toxicity. This is very famous drug-drug interaction. So some drugs, they inhibit cytochrome B450, therefore they might inhibit the metabolism of drugs which are metabolized by cytochrome B450, and this will produce toxicity. In this case, what we have to do is to reduce the dose of drugs metabolized by cytochrome B450. We have to reduce the dose. This is logic. Okay? So this is phase 1 metabolism. Phase 1 metabolism, we said, it involves oxidation and reduction and hydrolysis. Hydrolysis mostly takes place in plasma by plasma esterases. Oxidation and reduction takes place in the liver by liver microsomal enzymes. Liver microsomal enzyme activity can be affected by many factors. I will show you first thing, we said can be affected by liver disease, also it can be affected by chronic administration, can be affected by drug-drug interaction, and can be affected by drugs which can inhibit the liver microsomal enzyme activity. This is phase 1 metabolism. The second type of metabolism is known as phase 2 metabolism. What happens in phase 2 metabolism? What happens in phase 2? Usually, in phase 2 metabolism, the drug molecule is conjugated with another larger molecule to form a complex. Just if you imagine, this is the drug molecule. This is the drug molecule. It will bind or conjugate with another molecule to form highly polar complex of large size, of course, of large molecular weight. Highly polar, that means water soluble, it can be excreted easily, and it is large in size, therefore it cannot cross biological membrane. For example, if it is present in the urine, it cannot be reabsorbed back into the general circulation. How this happens? What are the molecules? These molecules can be glucuronide, or sulfate, or acetate. Okay? So drug molecules combined with the glucuronide molecule or sulfate molecule or acetate molecule to form highly polar complex with large molecular weight which cannot be reabsorbed. The first process of binding with the glucouranoid is known as glucourinidation. Glucourinidation. Okay, this is very famous. Many drugs, they are conjugated with glucourinide. The process of glucourinidation sometimes, and most of the time, the compound is inactive. Like in sometimes the conjugated complex is more active pharmacologically, like what happens with morphine. Morphine is active pharmacologically, but when it is conjugated with glucourinide, it is converted to more active morphine 3-hydroxyglucourinide. Okay, morphine by conjugation with glucourinide is converted to morphine 3-hydroxyglucourinide, which is actually more active than morphine itself. Okay, then this complex usually it is excreted in the bile, as we said later. But in most of the cases, the conjugation with the glucourinide will result in highly polar metabolite can be excreted. Second type of conjugation takes place with sulfate, a process known as sulfation. Sulfation as well, in most cases, it produces inactive metabolite, sulfation. In most cases, it produces inactive metabolite. For example, tamoxifen. This is an anti-cancer drug which has many utilization. In rare cases, sulfation will result in stable active metabolite. For example, famous minoxidil. This is famous vasodilator. Which is used as well in treatment of baldness because it increases hair growth. Third process, which is involved in conjugation, is the conjugation with acetate and process of acetylation. Acetylation takes place with many drugs like clonazepam, like caffeine, okay? So this is the process of conjugation here. Conjugation, it will convert the drug into highly polar complex of large molecular weight which can be excreted easily. In some cases, this conjugation will result in more active metabolite. So this is very briefly what happens with the process of metabolism. If we summarize the whole process, we say that metabolism function is to convert lipid soluble to water soluble molecule. This is the main function of metabolism. This is done through two phases, phase 1 and phase 2. We said in phase 1, this takes place by three processes, either hydrolysis, which takes place in the plasma mostly, or by process of oxidation and reduction. Oxidation and reduction are done in the liver by liver cytochrome B450 enzymes. With these enzymes, they are subjected to many factors like liver disease, like chronic administration, like drug-drug interaction, or inhibition. Third, we phase 2 metabolism, with a conjugation with certain molecule to convert a drug molecule to more polar, high molecular weight. In many cases, it converts it to a form that can be excreted. In rare cases, conjugation can result in a more active compound. I would like to thank you very much for your attention. If you like the presentation, I would appreciate pressing the like icon, subscribing to my channel. Thank you very much. See you in the next presentation. Wassalamu alaikum wa rahmatullah.